I'm a cardiac nurse here at Central St. Mary's. I'm one of our negotiating team members, and I'm the first vice president of the Nursing Association. I'm joined by unelected officials, some other nurses from Duluth. As you can see, we're here with a lot of nurses, strong support. We're really proud of our nurses for standing up, turning out today, and carrying on our message that we need to address staffing in our hospitals, and we need to address it now. We are incredibly frustrated that it took until Saturday night for our management responded to our staffing proposal. And we really felt like we were starting to be able to have constructive discussion on addressing that issue. Decided to go with that. Patients at the center of our negotiations. We're here because we know that we need to address this issue in order to keep our communities and our patients safe. And now I'm going to pass it on to Asha, to nurse
Thank you, Chris. My name is Natasha Thomas. I've been working here at Essential on our cardiac ward for the past 5.5 years. We're exactly not doing this. What's not coming out of this negotiation. It hasn't just came out of the blue when COVID became a thing. We had chronically short staff problems, and it has been exacerbated by this pandemic. I keep hearing from media and members of the public that this is all about profits. Management saying that we're selfish for being out here. Why aren't you thinking about your patients? This is for our patients, for our communities, for our families, for ourselves. Last night I worked until 11:30 p.m. and I cried on the way home. It's perfect to be out here. It's perfect that I'm doing it this is our proposal to come back with something that we can all agree. None of us want to go here. We want to live with our patients. Others safe. That's our job. That's what I just with our profession, that's what we love to do. And we can't wait to go back and but we're going to have to be out there. I'm also honored to be on the negotiating team there as well. There's a saying, nurses on the outside, problems on the inside, and that's evident today. We were forced to strike when our employers left the negotiation table on Saturday. So we were still willing to sit there and continue as long as it took to get what we could have done for our patients. The conditions in the hospital are untenable, they're unsafe, and they're dangerous to our patients and to our nurses. Our staff were poor prior to the pandemic. We raised our concerns to management where it fell on deaf ears. We continue to bring our concerns, suggestions, and solutions to management during these negotiations. And they've ignored us and responded with contract language that gives them more power and no accountability. Meanwhile, our patients continue to suffer. Imagine yourself in a hospital bed, waiting too long for pain medication to the point that you are now in tears. Imagine waiting too long for help to go to the bathroom, where you end up soiling yourself. Imagine waiting for days even cleaned up appropriately and accurately. This is not okay. This is not okay. When a nurse has too many patients, it increases the risk of medical errors and harm to you or your loved ones. As nurses, this is our biggest fear, to harm someone or miss something critical. We go home stressed, in tears often, with increases in cases of anxiety, depression, and other symptoms of compassion fatigue, as well as the fear of losing our nursing licenses. Who is going to support my family or anybody else's family who lose our nursing license? Many of us have left the bedside due to these stressors, and it's predicted in the next year another 50% of bedside nurses will leave. How does this help anyone? Are you okay with longer ER wait times, more expensive hospital stays due to delayed care? Because we're not. We've told the hospitals we're still here and willing to negotiate. Meanwhile, they keep telling the media that we all are greedy and want money. If you were so concerned with money, why did you walk away from the table on Saturday? They are losing millions right now and putting patients at risk. We demand that the hospitals return to the negotiating table to come to an agreement on language which protects your safety and protects our licenses. There needs to be language in the contract which holds them accountable for their actions and inactions. Because really, words do matter. I will pass it off now to a hospital member.
Thank you. Hello, everyone. My name is Mike Mayo. I represent the 2nd District of the Duluth City Council, and I just want to thank all 3 of our nurses here for sharing their stories today. Obviously, you can tell what they have been going through, and not just throughout contract negotiations, but throughout the past few years. This pandemic has taken a toll on all of us, but particularly in our hospitals who have seen everything. And I have been on the lines this morning for 3 hours this morning. I was out on St. Lucie Central lines and talked with many nurses and hearing their stories. There were nurses of anywhere from 12 to 37 years that they've been here. And this is the toughest time they've been through, period. And that was every single nurse. We really need to keep prioritizing our nurses and our healthcare systems. And looking at some of the headlines and things that have been said about this strike, it is not just about, it's not about profits. It's not about getting the most money that nurses can. This is about safe working conditions. This is about the health and welfare of not just our nurses, but of all of us, because they care for us and they are at our bedside each and every day. And when you talk about how long it takes to change linens or these basic services, those are things that I've heard out here today, again, on the lines, these real stories of people that are going through this each and every day. I'm out here today really just strongly supporting from my city position, and just as an individual that has, we all experience our healthcare system, making sure that our nurses get what they deserve. And, they don't want to be out here. This is a hard decision to walk away from a profession that you feel passionately about, that you are called to serve, and be out here outside on picket lines. So it says a lot that our nurses are here today. And I'd like to add one more thing, too, that we really need to be pushing our hospital executives locally, including myself and others on the council and legislature, to make sure that when these nurses return to work on Thursday, after the nation's largest nurses strike, that they are let back into the facility, that they are able to work. It is so vital that their right to work here is protected, because overall, we really are out here as a community, and the community is behind this. You can see it today. You can hear it in the background behind me. Duluth is ready to support our nurses, and we're going to be out here Tuesday and Wednesday as well. So I'd like to thank everyone. And I don't know, is there a wrap-up? You want to wrap up, Chris?
Yeah, thank you. So thank you so much. I can take any questions that anyone may have. Yeah.
Two questions. First and foremost, could you all give your first and last names and then just spell them for us? Or distinct each other?
Sure. Chris Rubich, CHRIS, and I'm the first vice president of the Minnesota Nursing Association.
Mike Mayo, MIKEMAYOU, and the City Council Second District.
A-Y, last name B-I-X-B-Y, RN at
Natasha Thomas, NATASHATHOMAS, registered nurse at Essential Health, St. Mary's Medical Center.
Thank you all so much. For my first first question, I would like to know, there was a notice put out today that Moose Lake has been withdrawn. They withdrawn from the strikes.
Yeah.
Could you tell us why was Moose Lake taken out of this striking process for the next 3 days?
Sure. So Moose Lake is in a slightly different position. So Moose Lake was acquired by Essentia Health roughly 2 years ago. So they are negotiating what is considered a first contract with the employer Essentia. They've been recognized and represented by M&A for years before that, but Essentia chose not to recognize that contract. So legally, they're looking at negotiating a first contract. Some of the requirements around filing are a little bit different. So out of an abundance of caution for their members, they withdrew. It's really unfortunate that Essentia Health and other facilities are using that kind of legal tactics to put pressure on nurses. And again, as Councilmember Mayu, insinuated, threaten retaliation on nurses. So it's unfortunate, but that was the reason for that.
Third question for you all: if you don't reach negotiations by the 14th that are up to your wants and standards, what is next?
Sure. So we'll be returning to work as scheduled on Thursday at 7 a.m. At that point, we'll return to negotiations. We don't currently have any dates scheduled. We're waiting and ready to negotiate with our employers. As soon as they give us dates, we'll make ourselves available. That's our priority. We hope that this will be enough to get movement on our top priority, which is staffing and bedside care. If not, we'll certainly be working with our members here and around the state to readdress what our next steps are.
Just some clarification on Saturday's negotiations. Was it Essentia and St. Luke's that were negotiating Saturday?
Correct.
How long did those negotiations last for each negotiations team, and who ended up walking away first?
Yeah, so I can speak for Essentia, the table that I directly sit at. We were at the negotiations table from about 9 o'clock in the morning till about 6, 7 o'clock at night. After we felt like we were starting to get some movement and have some constructive work on our staffing proposal, which is our top priority, management wanted to know if we had anything else to give. We said that we wanted to continue that discussion, and they said, I think we need to be done for the day, and walked away. We haven't heard from them since. So
as far as St. Luke's goes, we met with them, I believe, at around 10:30 on Saturday, and then we negotiated probably to about midnight that night. We had been having some really good discussions. We met Wednesday for about 15 hours, Thursday for about the same amount, took Friday off, and then kind of started again. It felt like it was moving in the right direction, and then management came in and just said that they were done, and we reiterated to them that we were willing to stay all night and continue to meet if they wanted to let us know dates and times before the strike to try to avert the strike, and we didn't hear anything back from them. So,
Question for either Becky or Chris, whichever one of you wants to take it. Are you guys at this point concerned about lockout possibly happening after the strike?
That's obviously something that our nurses are thinking about. We are prepared for that. We are standing strong and resolutely, as you can see by all the nurses behind us. We think that would be unfortunate because, again, we want to return to work and care for our patients. If the employer chose to do that, they certainly can. But again, we're ready to return to work at 7 a.m. on Thursday.
I also want to address real quick the kind of attack ad campaign that's been coming out, especially St. Luke's has been publishing a lot of advertisements around the internet and on the air as well. Do you guys have anything to address about that? A lot of it has been centered around wages and wage increases. How would you guys address that?
It's been frustrating because St. Luke's is spending a lot of money on those ads and spending a lot of time on those ads instead of actually spending time at the table, really trying to come for solutions. We've offered a lot of different solutions, but again, it kind of goes back to feeling like they want to keep control and not have that accountability, which is what a lot of the hospitals are doing. So that is really sad, and it is very frustrating for those messages to be coming out and kind of hurting the reputation of the nurses to some degree, because we are what keeps St. Luke's great, along with all the ancillary staff, all the doctors. We truly are a family, and it's just hurtful to kind of hear those types of reports and a lot of the different attack ads and fear tactics and all that kind of stuff. So it's been kind of surprising in some ways.
Yeah. There's been a lot of of those ads focused on wages particularly. Has that been your main focus at the negotiations table?
Nope. Staffing is our main concern. Staffing, yeah. I mean, what's frustrating is when you go in every day and you're trying to take care of other people's loved ones, and you can see yourself in that bed or another loved one, and to not have the time to give them the care that they deserve, or the dignity that they deserve, or just basic cares, is incredibly distressing. And just so many nurses are leaving because of that, and that does not help with retention. It doesn't help with the nursing problem, etc. So staffing is our biggest concern, but they're painting it otherwise.
If you could give just one
So I think one of our top asks at the Essentia table is we would like an employer and protections in our contract that will allow nurses to use their professional judgment in terms of their assignment and patient care. And that means being able to refuse an unsafe assignment without fear of retribution, without fear of retaliation, because we know, as you've heard here, we know what we're able to do safely. And having an employer who codifies in the contract that we're not going to discipline you for that seems like a basic ask.
How far apart are you guys on negotiations right now, respectively? And if you could quantify that for us, that'd be awesome. But I understand it's a little difficult, maybe.
So I'll just speak for Essentia. I'll let Becky address St. Luke's. But for us, again, on Saturday, we felt like management responded to our staffing proposal. Again, it was the third time we had rewritten it and the first time that they had actually responded to it. So we felt like we were actually making progress. I certainly saw a path to settling a contract. Apparently, the employer felt otherwise because they chose to walk away. And that's unfortunate. I certainly feel like there's a path to an agreement here. And I'm hopeful that we'll get there.
As for St. Luke's, we've passed back and forth a lot of different proposals with them, and we did come to some tentative agreements on some stuff, which was great, and we want to keep moving that direction as nurses, because we really do feel, what we're asking is reasonable. One of the biggest hang-ups is still like what Chris was talking about in terms of protection of the nursing license and not being essentially forced to take more patients and being worried about discipline. They'll, yes, they may not discipline you, but then at the same time, does that still put your license at risk? Because how am I going to support my family if I lose my license? So that's probably one of the biggest gaps that we have in terms of agreement. We did have some good sidebars where we were kind of moving in a pretty good direction, but then Saturday was a bit of a surprise that they wanted to leave after all those discussions. So I think all of us were quite shocked by that.
My last question, sorry for kind of dominating the field here, but is there any merit to the claims that this is an illegal strike that have now come from both hospitals?
So, we've seen those claims from hospital systems around the state. Some of those charges have already been thrown out by the NLRB. We're here exercising a legally protected unfair labor practice strike. We're striking in good faith. It's a legally protected strike until and unless we hear otherwise. So we're here knowing that this is a legal strike, and we don't believe otherwise.
Are you actually breaking the treatment of your physicians, not enough staffing? Are you fully at the break?
I would say, as demonstrated by the hundreds of nurses who are here, the thousands of nurses who are walking streets around the state, we are at and beyond our breaking point. I mean, for us, it's not about giving up our wages. That's certainly a concern that many of us share, but that's not our first thought. Our first thought is, if we don't do this right now to make sure that patient care tomorrow and the next day and the next day is safe, then I don't know what's going to happen when my family needs to go to the hospital. And so we're really here because patient care is at a breaking point.
Quick question on the safety proposal you guys have. So can you give me some more specifics? So your want protection, is this related to patient care? How many patients you have? Like, you want to be able to say, organizations or whatever it is. It's too many. Can you explain a little more detail?
Yeah, absolutely. So under the Minnesota Nurse Practice Act, which governs nursing practice in the state, nurses have the ability and responsibility to assess their patients, to deliver that patient care, and to determine what is and isn't safe. And so part of the difficulty is the Nurse Practice Act protects our licenses when we're doing that. But of course, if there are patients that our employer wants us to additionally take or admit or transfer, they can threaten us with discipline for refusing to take that assignment. And so what we'd like is an employer who's willing to have our backs and to say, we understand that you are highly trained, skilled professionals with licenses, and we respect your professional judgment. And we'd like them to codify that in the contract.
And with that, I know you just touched on it a little bit. In what specific way are your licenses at risk?
Yeah, so in a situation where something unsafe could happen, we could be brought in front of the State Board of Nursing, which again governs and licenses nursing practice in the state of Minnesota. And if there's an adverse event or something happens to a patient, we can be held responsible for that care that did or didn't happen. And as, again, highly skilled licensed professionals, we need to be able to use our professional judgment to say that we're not going to allow that to happen, and we need employers who are going to stand behind us and say we respect that judgment and we also want to keep patients safe, and so we're going to allow you to have a modified assignment or do what's necessary to protect the patients and your license.
Any other questions?
Thank you so much for being here.
Thank you.